We're Summit Therapeutics, and we have two programs. We have a program in novel antibiotics, which is far from rare. These are diseases that affect many people. But our main thrust has been in a disease called Duchenne Muscular Dystrophy, where we're developing a technology that came out of the University of Oxford that we call Utrophin modulation. So it's actually a really exciting time for parents and children with Duchenne Muscular Dystrophy, with developments in many fronts. Our technology is called Utrophin modulation, and what we're trying to do is to replace the missing dystrophin that these boys are unable to make because of a genetic fault with a similar protein that they are able to make called Utrophin. And this all originated from some research at the University of Oxford, which started about 20 years ago when this additional protein was first discovered, and it's the way it develops in human muscle was worked out. And then Professor Kay Davis had the idea that perhaps in these children that don't make dystrophin, if we could get them to make Utrophin, maybe that could give them ultimately a cure. So she did some really pioneering work back then using some transgenic animals where they put an additional copy of the Utrophin gene so that these animal cells were pumping out Utrophin all the time, and they completely reversed the phenotype. They were able to reverse all the symptoms of Duchenne Muscular Dystrophy in these mice. And so our company was founded on the premise that if we could get humans to make additional Utrophin, maybe that would be of great benefit to boys with Duchenne Muscular Dystrophy. So first of all, we started looking for drugs that we could give to people that would get into their cells and get them to start making more Utrophin. And we now have a lead compound, isotramid, which has been through some really great animal studies. We've also shown that it's able to get human cells in the test tube to make more Utrophin. And now we're really at the crunch time, the really exciting time, where we're testing isotramid in a trial, a phase 2 trial, which we call PhaseOut DMD, in a study in boys with Duchenne Muscular Dystrophy. So this phase 2 study has recruited about 40 boys with Duchenne Muscular Dystrophy in the United States and the United Kingdom. About half the boys have come from each country. And they take the drug twice a day. It's an oral suspension, so they take it with a meal, either first of all with a breakfast and then with a late afternoon or early evening meal. And then we follow them up and we measure a whole lot of things. It's a very intensive study. First of all, we look at biopsy samples. So before treatment, a biopsy is taken from one bicep, and then for about half the boys, we take a biopsy from the other bicep at 24 weeks. And then at 48 weeks, the end of the main part of the study, for those boys who did not have a 24-week biopsy, we take it. So we've got a snapshot of what's happening in the muscles of these boys, what it was like before we started treatment, what it's like after 24 weeks, and then in the not too distant future we'll know what it's like after 48 weeks. Another group of endpoints that we look at are based on magnetic resonance. A big advantage of using MRI and MRS is it's not invasive. You know, for the biopsies it's minor surgery. We have to take a chunk of muscle from the boys' arms. But with MRI, it's a physics-based measurement. The boys have to sit still for a while, and as you know, that's quite a problem for small children, but we keep them occupied and we're able to take these measurements. The big advantage of MRI is because it's physics-based, it has much less variation than things. So if we have a drug effect, we should see it. And then the final group of tests are functional tests, how far the boys can walk in 6 minutes, the famous 6-minute walk distance test. Then there's a whole group of other tests that make up the North Star ambulatory assessment. And we also look at upper limb performance with a range of tests around that, and also tests of breathing by various respiratory tests. So these outputs will be are really in three buckets: the biopsy analyses, the MRI analysis, and all these functional tests. And we were hugely excited recently because the last of the boys had gone through the 24-week time period, and so we were able to do the interim analysis at 24 weeks. And to our joy and great pleasure, we've really found some material improvements in the muscle function, in the muscle structure, as measured in the biopsies of these boys at 24 weeks. So obviously, the main thrust of what we're trying to do is that the drug should change and start making utrophin at times when it wouldn't normally be made. And indeed, that's what we've seen. We've seen a change in the utrophin profile in these muscles, with more utrophin being made after treatment than before. But the really profound measure is in a measure of muscle damage. So when your muscle or my muscle gets damaged, a repair process starts, and one of the proteins in the muscle called myosin has a form that's only present during the first 30 days of repair, so-called developmental myosin. So if we track the amounts of developmental myosin in the muscle of these boys, we get an indication of how much damage has gone on and how much recent damage has gone on. So when we look at the biopsies of the boys at baseline, we find that between 11 and 12% of all the fibres in the muscle have undergone a very recent repair. But after 24 weeks of treatment, that proportion has reduced by about a quarter to between 8 and 9%. And that's a really profound reduction in the amount of repair, and therefore a reduction in the amount of muscle damage that's gone on. And so that's hugely exciting for our drug, and really encourages us to think that the drug's having a beneficial effect, and that as we follow up the boys for longer, we'll start to see further downstream effects. So after many years of Kay Davies's first idea at the University of Oxford and the work that we at Summit have done to develop izutramid, we've now seen the first signs of proof of concept in this phase 2 trial, with the interim look showing a significant and material reduction in muscle damage. So we're really excited by this.